Okay, so we are going to Wellington Towers. All of the ones in Wellington Towers are part of the Aging in Place program. There's quite a few there. There's probably about 20. I think the hardest thing is when you find out that either nobody or very few people have come to visit. You know, for a lot of people, you know, their family's in touch with them, or friends are in touch with them, and in many cases they can go out and get their own groceries, or medications are delivered to the address. Okay, so that's great. But when you find out that somebody's been in their apartment since February and nobody's come to visit, it's hard. Languages sometimes are a barrier. As you can see, today wasn't too much of a barrier, but they are, you know. And so I've asked them, do they have family that they, you know, that comes and brings their food? Yes, we do. So I get their phone number and I call them up while I'm there. And so there is that translation so that we can answer the questionnaire and make sure that the person is okay. But we've had people who speak only Russian, only Ukrainian, only Arabic. You know, we had one family who only spoke Burmese. And in that case, the woman, the household, told me that they had a translator, and I called the translator, and then we were able to get the answers for the questions. Again, it's not a form-filling exercise, but there's certain information that we need. So you can ask the question in a different way, but there is information that we're asked for by the City of Ottawa. And if you miss some of that information, it's, you know, you miss some critical data. Because in the end, we want to make sure that people are well, they're healthy, they're safe, they can get groceries either through friends, family, or they can get it themselves, or if they're on medications, that somebody is bringing them their medications. If there's anything else, if they're not coping very well, you know, it's up to us to determine, okay, well, maybe there needs to be a friendly visit, or somebody has to come from Ottawa Public Health. These are all things that the city wants to know, because the people that we're visiting here are one of the most vulnerable.